Welcome back. I'm Nurse Educator Chelsea, and today we're going to be talking about cirrhosis. Cirrhosis is a chronic and progressive disease of the liver characterized by diffuse degeneration and destruction of hepatocytes. Each time the liver is damaged, it tries to repair itself, causing scar tissue to form. With more damage, more scar tissue forms, making it more difficult for the liver to function. Liver damage from cirrhosis generally can't be undone, but if diagnosed early and the cause is treated, further damage can be limited. Early symptoms of cirrhosis can be very vague and nonspecific. Symptoms of cirrhosis can include easy bleeding or bruising, fatigue, nausea, loss of appetite, weight loss, jaundice, ascites, itchy skin, confusion, drowsiness or slurred speech, lower extremity swelling, abdominal pain or tenderness, electrolyte disturbances. In men, it can cause a loss of sex drive or breast enlargement. And in women, it can cause a loss of menstruation not due to menopause. Risk factors or causes for cirrhosis can include chronic alcohol abuse, chronic viral hepatitis, which can include hepatitis B, C, and D, autoimmune hepatitis, non-alcoholic fatty liver disease, which is often secondary to obesity, cystic fibrosis, Wilson's disease, hemochromatosis, infection, medications such as methotrexate, or a bile duct disorder. Testing for cirrhosis can include doing blood work, including bilirubin, liver function tests, which can include ALT and AST, hepatitis screening, checking PT and INR levels, and checking albumin levels. Imaging can include CAT scan, MRI, or ultrasound, and sometimes a biopsy may be done for a definitive diagnosis. Treatments for cirrhosis often include treating the cause of cirrhosis and treating the symptoms. If alcohol abuse is the cause of cirrhosis, we do recommend abstaining from alcohol, which can include treatment for dependence of alcohol. Weight loss is also recommended if the individual is obese. We can also use medications to control hepatitis or medications to control other causes or symptoms. We may also need to control excess fluid from collecting in the body, which may mean using diuretics or performing a paracentesis. Diet modifications or supplements may also be utilized. Lastly, a liver transplant may be considered, but if cirrhosis is due to alcohol abuse, the individual will likely not qualify. There are quite a few complications associated with cirrhosis. Some of these can include portal hypertension, esophageal varices, splenomegaly, bleeding, infection, malnutrition, hepatic encephalopathy, increased risk of liver cancer, or multi-organ failure. Nursing implications for cirrhosis can include providing education on a low-sodium, high-protein diet, education on fluid restriction if prescribed by the physician, education on the importance of limiting alcohol intake, monitoring for weight gain and other signs of fluid retention, elevating the head of bed to minimize shortness of breath, monitor level of consciousness for new or worsening confusion as well as bleeding, and if procedures or surgeries are planned, such as a paracentesis or TIPS procedure, provide the patient with education on that procedure or surgery. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.